Hi, here we are at Health Check Physical Therapy. I'm here with Gloria Power, a mature lady who we have seen in physical therapy quite a few times, you know, on and off, just to get tune-ups, so to speak. Gloria came to our facility back in around January and was having some issues with her knee, yeah. And you know, often we have issues with our knee, and it affects other phases of our life. So, Gloria, why don't you just briefly just tell people out there how this impacted you? Not only just the fact that you had knee pain, but other ways your life was affected.
When your knee aches, I think you sort of ache all over, and it affects your ability to get around because it hurts every time you move the knee, and it affects your attitude toward things because you become a little bit irritable because you're in such pain most of the time. So you lose your appetite when you're in pain, and you're just not the happy-go-lucky person. Consequently, I came back to Tom, and by doing this set of exercises that he has organized for me, I find that everything has improved considerably. My mobility is better, my balance is better, my mental attitude is better, and my physical being is better from being exposed to this type of a setup.
Yes, and you know, the reason why I bring Gloria here is because Gloria is a mature woman who has been around a few years, and we get people that are in their 60s or even 50s that will come to me and they'll say, you know, my doctor just said I'm getting old. And I said, well, you don't have to accept that. You need to look at the things that you used to be able to do, and that should be part of your goals in your physical therapy. And have you been able to do some things that you haven't been able to do for a while?
Yes, I have, and I've been able to do my daily routine with much more comfort, which is really the important thing that you want to do. And we don't use the word OLD in my vocabulary. Even though I'm 91, I'm very mature. I am not OLD. And you will be OLD if you don't come over and get yourself moving in this program that Tom offers.
Thank you, Gloria. And you know, we see a lot of people that have knee problems, but you know, the known fact is that over 80% of people have some type of back pain or have had back pain in their life. So if their knee goes bad, their back's going to hurt more. If sometimes people will have shoulder pain, and it also will trigger problems with their neck. So we not only look at the injury as, you know, you see it whether you had knee pain, but we also say, how does that knee pain affect your balance? How does it affect your ability to go up and down stairs? How does it affect your ability to get in and out of the car? Some people still want to garden and do things in their backyard, and how does it allow them to be able to do raking and shoveling? And this time of the year, we're in springtime, and people like to mulch, they like to trim trees, and do things around the house. Have you been able to find around the house, you're able to do a few things that you weren't able to do before?
Absolutely, and I think the bottom line is that if you want to be able to move around and be a happy person, you need to keep those joints greased and moving, and Tom's facility offers you just that opportunity to do so.
All right, and Gloria, you know what amazes me is the way you move and the way you can walk a lot more steady than you did when you first came in. And we were talking about, you know, the fact that people, you know, as they mature and they're looking for maybe an alternative place to live, a facility, have you, what do you have to say about that? And some of the friends that you have seen do that move to that kind of lifestyle?
I think a facility is great for some people. I'm just not one of them. I like living in my own home, and with the good Lord's help, I continue to do so because it allows me more freedom. I can come and go as I want. I don't have to get up and have coffee at 8. I don't have to dress for dinner if I don't want to. I can go in my jeans. There's nothing like being in your own home. And by being kept in good physical condition and having your mobility at a really safe level, you can do this. And it's up to you. It's your attitude. If you want to be well and do well, come to see Tom.
Right, Gloria. Well, thanks a lot, and I appreciate your time. And you know, if those people are out there, if you want help and you want us to evaluate, maybe you don't know what physical therapy can do for you. Maybe you have never been to physical therapy. You may want to come in and get a free consultation, or call up and say, you know, I want to come in and just talk for 5 or 10 minutes and look at the facility, maybe talk about the issues you might be having, and we could talk to you and see whether physical therapy could help you. So please give us a call at 610-269-5070 and be glad to talk to you.